Jai Gurudev. Today we are speaking with Dr. Maya Singh, an expert in stress management and a practitioner of the art of living philosophy. With a wealth of experience in meditation techniques like Sudarshan Kriya, she has observed firsthand the positive impact these practices can have in high stress environments such as hospitals and clinics. Dr. Singh, can you share your insights on the stress faced by healthcare professionals and patients? Absolutely, the healthcare environment is incredibly demanding. Nurses and doctors often experience high levels of stress due to long hours, emotional fatigue, and the weight of patient care. Research indicates that over 50% of healthcare professionals report burnout, which can negatively affect patient outcomes. Patients too face anxiety and stress, which can impede recovery. How do practices like meditation and Sudarshan Kriya contribute to alleviating the stress? Meditation, particularly Sudarshan Kriya, helps individuals achieve a state of deep relaxation and mental clarity. Scientific studies have shown that regular practice can significantly reduce stress and anxiety levels. For instance, a meta analysis published in JAMA Internal Medicine found that mindfulness meditation programs can reduce anxiety, depression, and pain. In the context of healthcare, when staff engage in these practices, they report improved emotional resilience and greater capacity to handle the challenges of their roles. This not only enhances their well being, but also translates into better patient care. Can you elaborate on the effects of Sudarshan Kriya specifically? Sudarshan Kriya is a rhythmic breathing technique that aligns the body and mind. Research published in the Journal of Clinical Psychology highlights that this technique can reduce stress biomarkers and improve overall mental health. Participants in studies have shown marked reductions in cortisol levels and improvements in mood and vitality. In hospitals where the atmosphere can be tense, implementing such breathing techniques as part of the daily routine can foster a calmer environment. This not only helps healthcare providers, but also has a ripple effect on patients who often pick up on the emotional states of those caring for them. What about patient recovery? Can meditation impact that? Absolutely, there is a substantial evidence indicating that stress reduction practices can improve recovery times. A study published in Health Psychology found that patients who participated in mindfulness based interventions experienced shorter hospital stays and better post operative recovery. The calming effect of meditation can lead to lower blood pressure, reduced pain perception, and enhanced immune function. By creating a peaceful environment, we enable patients to engage in their healing processes more effectively. When staff are less stressed, they can offer more compassionate care, which is essential for patient morale and recovery. Are there any specific examples from your experience that illustrate these points? Yes, I recall a program we initiated in a local hospital. After introducing meditation session for staff and patients, we observed a remarkable transformation. Staff reported feeling more energized and less emotionally drained, while patient feedback highlighted improvements in their anxiety levels. Data collected showed a decrease in the average length of stay for surgical patients and a drop in reported pain levels. This aligns with findings from peer reviewed studies, which suggest that meditation can not only improve psychological well being but also lead to tangible health outcomes. As we wrap up, what would you say is the key takeaway regarding meditation in healthcare? The integration of meditation and mindfulness practices into healthcare settings can create a more peaceful and supportive environment for both caregivers and patients. It is not just about individual wellness, it is about fostering a culture of compassion and healing that benefits everyone involved. By embracing these practices, we can enhance the overall healthcare experience, leading to faster recoveries and a healthier workplace. Today, we are joined by Dr. Maya Singh, an expert in stress management and a practitioner of the art of living philosophy. Dr. Singh, with your extensive experience in meditation techniques like Sudarshan Kriya, can you explain the stress levels faced by healthcare professionals and patients? Jai Gurudev, and thank you for having me. The healthcare environment is indeed a high stress space. Nurses, doctors, and patients alike experience significant pressure. Studies show that nearly 50% of healthcare workers face burnout, which adversely affects their mental health and the quality of care they provide. For patients, the anxiety of illness can complicate their recovery. How can practices like meditation and Sudarshan Kriya alleviate this stress? Meditation and specifically Sudarshan Kriya has profound effects on reducing stress. Research published in JAMA Internal Medicine indicates that mindfulness practices can significantly decrease symptoms of anxiety and depression, contributing to overall well being. For healthcare professionals, engaging in these practices fosters emotional resilience and enhances their ability to cope with workplace challenges. What makes Sudarshan Kriya particularly effective? Sudarshan Kriya is a rhythmic breathing technique that harmonizes the body and mind. A study published in the Journal of Clinical Psychology demonstrated that participants who practiced Sudarshan Kriya showed reductions in stress biomarkers like cortisol and improvements in mental health metrics. This calming effect is crucial in high pressure environments like hospitals. When healthcare staff practice these techniques, it creates a more serene atmosphere, benefiting not only them, but also the patients who absorb the emotional states of their caregivers. Can meditation influence patient recovery? Yes, it can significantly enhance recovery outcomes. Research in health psychology found that patients who engage in mindfulness based practices experience shorter hospital stays and lower pain levels post surgery. Meditation promotes relaxation, which is essential for healing. When healthcare providers are less stressed, they can offer more compassionate care, which positively impacts patient morale and recovery. Do you have any real world examples of these practices in action? In one hospital where we introduced meditation sessions for staff and patients, we noticed remarkable changes. Staff reported increased energy and lowered stress levels, while patient feedback indicated reduced anxiety. Data showed a decrease in the average length of hospital stays and lower pain scores among surgical patients. This aligns with studies that show meditation improves both psychological and physical health outcomes. What is the key takeaway regarding the role of meditation in healthcare? Integrating meditation and mindfulness practices into healthcare settings can create a culture of peace and compassion. It is not just about individual benefits, it is about transforming the healthcare environment to promote healing for both patients and caregivers. By embracing these practices, we can enhance the overall experience and effectiveness of healthcare delivery. Today, we have the pleasure of speaking with Dr. Maya Singh, a renowned expert in stress management and a dedicated practitioner of the art of living philosophy. Dr. Singh, would you start by discussing the stress levels experienced by healthcare professionals and patients in hospitals? Jai Gurudev, and thank you for having me. The healthcare environment is incredibly challenging. Nurses and doctors often deal with long hours, emotional strain, and high stakes, which can lead to burnout. Research shows that over 50% of healthcare professionals experience significant stress and burnout, negatively impacting both their well being and patient care. Patients to express anxiety related to their health conditions, which can hinder their recovery. In this context, how can meditation and techniques like Sudarshan Kriya help? Meditation is a powerful tool for stress reduction. Sudarshan Kriya, in particular, is a rhythmic breathing technique that fosters relaxation and emotional stability. A meta analysis published in JAMA Internal Medicine found that mindfulness practices significantly reduce symptoms of anxiety and depression, leading to improved overall well being. For healthcare providers, incorporating these practices can enhance their resilience and improve their ability to provide compassionate care. What specific benefits does Sudarshan Kriya offer to healthcare workers? Sudarshan Kriya not only calms the mind but also helps regulate stress hormones. Research in the Journal of Clinical Psychology has shown that participants practicing Sudarshan Kriya reported decreased levels of cortisol, which is linked to stress, along with improved mood and emotional regulation. This creates a more harmonious work environment, which is crucial in high stress settings like hospitals. Can meditation also impact patient recovery rates? Definitely, studies indicate that meditation practices can enhance recovery outcomes for patients. For instance, research published in Health Psychology found that patients who engage in mindfulness based interventions had shorter hospital stays and experienced lower pain levels post surgery. The relaxation fostered by meditation not only helps patients cope with pain and anxiety, but also facilitates faster healing. Can you share any specific examples from your experience? In one hospital where we implemented regular meditation sessions for both staff and patients, we saw significant improvement. Staff reported feeling more balanced and energized, while patients expressed reduced anxiety levels. Data collected showed a decrease in the average length of hospital stays and an increase in patient satisfaction scores. This aligns with broader research indicating that meditation can lead to better health outcomes. What broader implications do these practices have for the healthcare system? Integrating meditation and mindfulness into healthcare can transform the environment, making it more compassionate and supportive. It not only enhances the individual well being of healthcare providers, but also improved patients' care. Creating a culture of mindfulness can lead to better health outcomes, lower healthcare costs, and a more positive experience for both patients and providers. What is your final message about the role of meditation in healthcare? The key takeaway is that meditation is not just a personal practice, it can be a vital component of the healthcare system. By fostering mindfulness and emotional well being, we can create a healthier, more effective healthcare environment that benefits everyone involved, patients and caregivers alike. Jay Gurudev.